Welcome back to Voices in Health and Wellness, where we dive into the real-world stories of health practitioners who are building innovative, patient-centered practices and shaping the future of care. I'm your host, Dr. Andrew Greenland, and today I'm speaking with Laura Bunso, a physical therapist and certified manual therapist based in Jacksonville, Florida. Laura is the founder of Smart Body Physical Therapy, a thriving pelvic health clinic that's been transforming lives for 20 years or more. So with that, I'd like to welcome you to the show, Laura. Thank you so much for joining me today.
Thank you for having me. Good morning.
Good morning. So can you take us back to the moment you decided to start Smart Body PT and what was going on in your life at that time, if you're happy to share?
Okay. Gosh, it was a long time ago. I actually was at Mayo Clinic for several years, and I had been considering going out on my own. Don't know that I ever would, except that while I was 8 months pregnant, I unfortunately, which ended up being a gift, really, came down with meningitis while I was 8 months pregnant. And it allowed me to go into preterm labor and discover that my son would be born with no diaphragm. He had a congenital diaphragmatic hernia. And so that catapulted my life into a very different trajectory than a career. Thought I would be taking care of I hoped I would be taking care of a very sick child at that point, because I think that he was going to make it. I was told that he wouldn't. And he's doing great. He's a senior in college. But it did completely change my life. And because I had the pause and space and time and had resigned from that position, I thought I might go out on my own and be able to take care of people in my community in a way that I maybe couldn't have before, wouldn't have even maybe not even had the courage to do it, but it really changes your perspective on things when you have something like that happen.
For sure. So from that kind of central moment, tell us a little about the evolution of the business from that point when you made that decision.
So I just really started with doing orthopedics and pelvic health. I had done pelvic health at Mayo Clinic. It was really the centerpiece of my practice and was on the labor and delivery task force and things like that in the hospital whenever they had women's health as part of their care. So it was very close to my heart. I did it in school with one of the residency programs, but didn't think that it could be really a main piece or a staple of any sort of business, and was really advised against it. But just kept growing naturally. Started from one little, just rented a room from a colleague of mine, an OBGYN, and kept really just getting lots of referrals for it until had this shift. My company won the Athena project, which is a local business project for our female-owned businesses here, and had some really great guidance with them to go ahead and make pelvic health our bullseye, and that's men's and women's health. And it was really quite scary to have that as a focus, but it was so underserved and just such a need. And every patient that I spoke to, unless they were coming from a source that had this inside knowledge to be able to start to access this, but every patient had a story that was similar. That why didn't my doctor tell me about this 20 years ago? How come no one talks about this? Whether it was pain with intercourse or bowel or bladder control, or just so many things that would tuck up under that you might not be able to just discuss in a public setting to get some guidance like you could for your shoulder hurting. And so I knew that the need was there, but I wasn't quite sure how to go about the business part of it. But was brave, and with the encouragement of these wonderful people that were on my panel, went ahead and moved forward into just fully scaling all pelvic health, and that's all we're doing now. So
amazing. So I mean, you just mentioned that you were kind of faced early advice that a pelvic health only model probably wasn't viable. And there was obviously something from within that made you think, well, actually, there's something in this. What was it that the Athena people came up with or managed to convince you to actually take this niche?
Well, it's funny when you ask a question like that, it makes you kind of look back at a really, like what was the pivotal moment or pivotal conversation? So, so the first part of that question, I remember sitting at lunch with a wonderful business advisor that I had who helped me a lot for more of a traditional outpatient physical therapy type of a model, and thought that this was a great thing to have as a specialty. And we were sitting at lunch in this full restaurant, and we looked around and he said, see, everyone in here, or he says, half of the people in here have back pain through at some point in their lifetime and would need care. There's just not enough people that need the pelvic help. And I looked at it and I said, everyone in here at some point in their lifetime is going to need pelvic health, whether it's a teenager struggling with sometimes leakage during running or something like that as a female athlete, a woman postpartum, of course, males with pelvic pain. We treat helicopter pilots all the time here with pelvic pain. Post-prostatectomy, cancer treatments later on, and just, the whole spectrum. And so that sort of shifted his mindset. And then later on, of course, after the whole Athena experience and us switching to pelvic health, he was like, you are right. You can definitely do a whole business of this. But with the Athena project, that panel of experts, and then specifically Jennifer Holland, who's a branding expert, and she is fantastic with helping you get dialed in on exactly what makes you special, what makes your company special, and what's so special about the people that are working with you. And really, just we actually closed the company for the day and had one of my dear friends who was working with me at the time. Her daughter is a musician, came in, played music. We very kumbaya whole day about who are we, what are we trying to do here, and what makes us different, and what can we offer to our community that is really of the most value and service. And the thing that we came around, that and I didn't really talk much, which was unusual for me for some of what we're doing. But really was our staff, and she went around talking to each of them, and this was really turned out to be the heart of everything that we're doing. Everyone was crying by the end of the day, because some of it is really life changing. Some people aren't going to have their life completely changed because they're having a little leakage, they're a little damp after they go for a run or they do some jumping jacks. But some of the other things that we're doing are really, really change people's lives, keep them out of the emergency room, or keep them from having some life-changing surgeries like an ostomy, surgery or something like this. So that's really where it came from. And then they gave me really the push and the courage on the business side to help kind of develop out the plan to be able to move forward with it.
So I guess pelvic health is finally gaining more attention, if not already from your work, but I guess it's probably still under discussed. What's changed in your patient population or the referrals you've had over the last few years from your perspective?
So I think that there's honestly, TikTok has probably changed a lot of what we're doing, which seems a little goofy to say, but it's really lifted the veil for a lot of people as far as what the potentials are, what the possibilities are for them to be able to have help with some of these things, in all age groups too. As we know, it is not that probably the creators are tend to be younger, but the consumers of social media are all ages. And I think that has they're good and bad about everything. And I think one of the beautiful things is in all areas of health that a lot of us are gaining that knowledge of some of these things that we're suffering with are maybe not as acceptable as we thought that they were, or that we had been taught by generations, even if it wasn't a conversation, but it was by, watching your grandparents wear diapers, that's something that we are learning as we are walking through life, that's just a part of life. Whenever they're really, it's not something, just because it's common doesn't mean it's normal, is one of the things that we say on a regular basis.
Thank you. So would you mind just talking through like a typical patient journey? Now, I appreciate you treat a diverse range of conditions, but what does a typical patient journey look like from the moment they come to you to the kind of work that you do with them and what the outcomes might be for them?
So they may come just directly from hearing about another patient. Excuse me. They may hear from a friend or something like that. So there are all kinds of avenues for them literally landing on our doorstep or on our a phone call. And typically, we found this, it seems a little silly to say, but we found to make sure that the patient knows that they will be undressing whenever they come to have a consultation with us, typically if they're coming for anything related to sexual function, bowel or bladder function. And so the evaluation would involve history taking and really just making sure that the thing that they're coming in for is related to the thing that we are specializing in and treating. And oftentimes they're coming from a specialist physician that's already screened out anything more sinister than something musculoskeletal. And then we will do a lumbopelvic girdle screen where we do some range of motion and strength testing, maybe a little sensation testing depending on what their complaints are. And then we'll walk them through the anatomy and exactly what we will be assessing and what the pelvic floor muscles look like, because most people have no idea. And then do the exam, which would be for female, be a vaginal and rectal exam, which is really quite quick, no metal objects, no speculum, no stirrups or anything like that, just a gloved hand. And then for the males, just a rectal exam to be able to have an assessment of the pelvic floor contracting, relaxing, and getting the quality of the musculature with that. And then we come up with a plan based on what the integrity is of the muscle, just like if we were evaluating or assessing their shoulder, their hip, or their low back. And then carry on from there.
Thank you. And with such a vast array of different conditions that can be helped, what surprises people most about what pelvic PT can do for them?
Well, I think it's just surprising at all that there's any kind of pelvic PT to most people still. It's just maybe fewer people are surprised about it now, but I think I don't know. I'd say probably one of the things is really quite simple. Lately, I feel like I've had quite a few male patients that are having frequent emergency room admissions for what is being diagnosed as prostatitis, and having really pelvic floor tension and poor habits as far as behavioral habits or avoiding habits that are, drinking Diet Coke or drinking diet sodas or coffee all day, and then having a lot of tension in the pelvic floor for some high stress jobs, some high level executives that are just, maybe clenching, and then when they go to actually urinate, that they're pressing and pushing hard. So doing some retraining of the pelvic floor. Actually, I just did I did an episode about it called "For Men Only" on my podcast. That's my most recent episode, because they're 3 visits and their life is completely changed. They're not going to the restroom every 30 minutes. They aren't having to plan their flights around how long it will last or if they could get up or those kinds of things. So that's on the simpler end of what we might treat. But I think for a man in that kind of a role, it can be just really shocking and overlooked that can be a component of that care. And to be clear, oftentimes these are middle-aged men who maybe do have a little enlargement of the prostate, but it's not aware. Maybe 80% of their symptoms were actually coming from this dysfunction of the pelvic floor that wasn't even considered as a contributor. But it's not unusual for, anything in this area. We call it, the pelvis in our world, we call it the center of the universe. It's scary to have anything in this area of your body have something wrong with it, whether it's hurting, not working correctly, difficulty getting your stream started, difficulty holding your urine, or your bowels are alarming and shocking as they should be, because it can be an indicator of something quite sinister happening. But because I think that there's such a long list of sinister things that could be the cause of that, our healthcare system starts there. But that's how we address most things. So, and the musculoskeletal component is quite overlooked. Really, even with bowel dysfunction, the number of emergency room visits over abdominal pain and constipation, which can be quite severe. As someone can have a constipation that is literally, we call it outlet dysfunction or outlet constipation, which is, a lot of people don't like to discuss it, but it's a very real thing. But it can be so severe that they do end up needing an ostomy, or even vomiting stool is really kind of the worst end of things that can happen. And you can get so backed up. But the way that I describe it to patients is it's sort of like trying to get the furniture out of the room with the door closed. They often can, with all kinds of medications that essentially the mechanism is really to liquefy their stool, so that they're, I'll tell patients that, if our life depended on it, we'd get this furniture out of this room, we'd splinter it into 1,000 pieces and, slide it under the door. And that's essentially what we're doing with a lot of these medications that are designed to help with, whatever the claim is, motility, all of these things. But oftentimes with that sort of dysfunction, and thankfully we have a lot of gastrointestinal physicians in town, excuse me, that will screen for this and actually refer them for it, rather than doing an exploratory surgery. So that's really been actually a very big evolution in probably the last 5 years, is patients are coming to us for that kind of the bowel dysfunction without being cut on. Oftentimes in the past, they were having had some resection, some exploratory, laparoscopy prior to having just having a pelvic floor evaluation done, or some sort of anal defecography study, or anal manometry study. So now that's a little more of a part of the regular screening, I think. But I wish it was a little sooner. I wish it was earlier on the list. But yeah, that's I think those are probably two pretty shocking things for people once they finally land in front of us.
I can definitely speak to the constipation thing from the point of view. My day job is an emergency physician, and I think people will be very surprised to even know that people actually turn up to the emergency room with constipation to the level that you've mentioned. It becomes such a severe problem. People think it's all blood and guts and trauma and car crashes. It's not. We see so much constipation. So I'm really interested in your approach, your much more holistic approach. And I love your analogy about the furniture and the closed doors. I think that's a really interesting take. I couldn't help but catching earlier on that you mentioned that you have been aware of helicopter pilots. And I'm really curious to know, what is it about helicopter pilots that make them land on your doorstep, and what kind of problems do they have that you can help them with?
So, well, I think it's anyone who is stuck inside of any particular container with high stress, high stakes happening. We have a lot of military around us here, and that's got a lot to do with it. Um, I'd say helicopter pilots, executives of large companies that cannot leave a boardroom or have a very intense. We have Jacksonville, Florida is where we're based, and we have a lot of large corporations here. And it's a lot of them. It's really surprising. And sometimes I'll even have the conversation with, at least on the executive end, I'm like, you're in charge of the meeting. Pause the meeting. Tell everyone to go get a drink of water and go to the restroom. Like make a shift and have everyone walk around a lap or something like this so they can take a little better care of themselves. But and I think in terms of the pilots or they can't pause. They may be on some sort of mission and have the intense physicality of their role, of course, in addition to the stress and the inability to be able to access facilities, obviously. So they're yeah, so that it's interesting because it's a lot of them. Yeah.
And do you have any funky tools that you use in your work? I think you mentioned on a previous call about surface EMG. Is there anything else that helps you with your work
Yes.
that's quite advanced?
So yes, it is, and the literature shows that especially for bowel dysfunction, that it can be quite crucial. It's a little bit more expensive of a tool as far as physical therapy goes. Usually, physical therapy is quite inexpensive. So when I say it's more expensive, I mean relative to physical therapy. As far as medicine goes, it's still, a little, straw hut compared to the huge skyscrapers of healthcare. But surface EMG gives you a visual and an auditory representation of what your muscles are doing. The muscles are hidden; they're tucked up inside your vaginal and rectal muscles, and for the men, the pelvic floor muscles are the not just the back half, the rectal, but the front half, which would be in charge of making the penis nod or clamping down to cut off the flow of urine on the urethra. But we will put these little stickers about maybe not even an inch wide, right at the perineal space, which is for women between the vagina and the anus. And some women here in the U.S. at least think about where you might have an episiotomy. That's the space where these would go. And for males, they go in the same space, but it's behind their testicles and in front of the anus. Or they can have a vaginal sensor or a rectal sensor. But usually we just use the little surface electrodes that go on the outside. And then there's a little wire, and we have a Bluetooth actually to our tablet that people can see, and they can see the line move. So when they're relaxing, it's here. When they contract, it moves up, and it may stay up or it may come down depending on how well they're able to contract or relax. And so we can use it really, even with urinary leakage. To help with coordination training. And so the beautiful thing about our bodies, and it's true for the pelvic floor, is it to feel good or for it to function well, it's not required for it to be a perfect system. It just usually needs to be pretty good. We for us to have a good healthy life and feel good in general, we don't have to eat perfectly. We don't have to do everything perfectly. We just need it to be most of the time pretty good. So the same thing is true, I think, for our pelvic floors, where you just need it to be coordinated. You don't have to be at normal strength, perfect strength to be dry, but you do need to be doing what it is that you think you're doing. And what I mean by that is oftentimes, for example, with bowel dysfunction, people are doing what's called a paradoxical contraction. They're sitting down to evacuate, they're pushing, they're straining, they're working so hard, and they're accidentally contracting the pelvic floor and pulling it up and in rather than letting it lower and open. And really, the harder that they try, the harder that they push against it. And using the same door analogy, if you took all that furniture and you just pushed it and shoved it up against the door, you're definitely not getting the door open to be able to let the furniture get out. So that biofeedback lets them see, and we will do functional biofeedback too, where we'll have them sit on the commode with the electrodes and practice. And I'll say, do all the things, and they get a little privacy in the restroom, with the electrodes, and we can see what's happening on the tablet. Do all the things that you're doing at home to try to evacuate, to try to have a bowel movement. And so they'll do all this thing, and what they'll see happening is that the line's going up, equal with a contraction, which they would be doing if they were trying not to pass gas at a dinner party. And so once they have that revelation, that alone is helpful, so that they'll quit straining and quit working so hard and at least bring the tone down. But then we usually have got to go a step beyond that, because oftentimes they've just developed so much tension and clenching, and oftentimes it's habit, to be able to just relax the pelvic floor. And so they get that visual feedback to be able to see how they're doing on it. And they get to practice. And just like anything else, it often takes a little bit of practice to be able to get that to where because they get a little panic, especially if they've gone to see you in the emergency room a couple of times and they've had this whole, anytime we go to the ER, it just wrecks our world. Everyone's world stops. It's important. If you're important in their life, everyone's world stops for you if you're going to the emergency room. And then whatever things cascaded from that. So there's just this whole, almost a trauma response around it. If they start to get backed up again, even if things are working a little bit better. So they do have to do some training and have some guidance and coaching really on working on this and having this be an effective thing for them. And one of the other things that can be tied into this is actually orthopedics and musculoskeletal, a little more on the traditional physical therapy side, but sometimes it's not just as simple as them learning how to relax the pelvic floor. Sometimes they can't if they have something else going on, and that's part of what the lumbopelvic girdle screen is for. If someone has a labral tear of their hip, which it's common. If you have a thin Caucasian female, it's likely she may have a little labral tear of the hip, but it may not be symptomatic. But for people, male and female, who maybe have a labral tear of the hip, and we work closely with a couple of orthopedic surgeons here in town to help us with caring for them and screening that out a little more to be sure that that's not part of the reason why they're having this tension in the pelvic floor. Your pelvic floor is actually the obturator internus is one of your hip muscles. It does the rotation of your hip. It helps provide the stability of your hip when you're standing on your leg. It's supporting it, and it's part of that pelvic girdle. So if you've lost some integrity of your hip joint, your pelvic floor may be just holding on for dear life and be the only thing really giving you support whenever you're doing anything physical. And so sometimes we have to dive a little deeper onto the orthopedic side of things to see if we can get to the reason why. So that can be really challenging too for the patient, going from GI, landing in pelvic floor rehab, and then ending up in orthopedics. They're usually very open to it though. They're like, there's something wrong, I don't know why, but I can't relax my pelvic floor. And so we can move into those, problem solving, all of those things to figure out what the actual source is of it.
Thank you. So look, running a clinic is never simple, and you talked about the early days when you were kind of going against the grain and wanting to niche down against some early advice. But right now, what's working really well for you in the work that you do?
What's going really well for us in the work that we're doing?
From a clinic business perspective, in terms of what you're doing at the moment.
Oh, business perspective. So Well, for us here in the United States, we're really challenged with reimbursement. So what works well for us is as a patient who is really just we're not managed by a health insurance saying, you know, you can only for example, some of them won't cover and or because there's such strong literature for it now, and there wasn't 20 years ago, not as much. They will cover it, but they may not include it in a patient's plan. So whenever we have a patient who's either just paying out of pocket, which is relatively inexpensive if they just pay for it, or if the health insurance will cover it and include it in their plan, that's the catch. Is they'll say that they cover it, but it won't be included in that particular patient's plan, so that they won't have it paid for. So because that piece of things can be so crucial, and it's not crucial for all of the things that we treat. There are some things that we treat that manual therapy, like with the pelvic pain, a lot of times manual therapy and teaching maybe a woman how to use dilators and walking her through all of that at home. It wouldn't be as crucial for someone like that. But you know, financially it can be really a big barrier for people if they need it. They're having, you know, all these hospital admissions. And one of there was something I heard early on in business of healthcare and said that, the easiest way to go bankrupt in the US is to get really sick. That, I don't know if that's completely true, but it does make it really challenging for people whenever it's not covered. So, having, being able to do all of the things and not be a financial burden to the patient, and just being able to take care of them and walk them through these things is really, it's really important. And it's really stressful for people to have to worry about that and manage that.
Thank you. I think the reimbursement thing seems to be universal. We've been having lots of conversations with North American clinics, and that always seems to come up. And it's not something we have to quite negotiate here in the UK. So it's always interesting to hear how you kind of manage and work through it. Is there anything else from a kind of a business challenging point of view, or any bottlenecks that you're facing at the moment as you kind of think about what you do, or perhaps even think about growth for the future?
So, well, thankfully, our biggest bottleneck is being able to have providers that are skilled and trained up enough to take care of all of the people that are coming in. We're grateful that the word is out. It definitely is much more. There are more people that understand that they have access to this sort of thing now than there used to be, for sure. And so we're trying to do what we can to be able to take really great care of people. But because it is obviously private and discreet, it's not like a traditional physical therapy where we can have three people at one time. We can, one patient in a private room is all we can do at a time. So we really just have to just step through our day and take care of each person individually. But with that being said, we do have 3 satellite offices coming, opening in about a week and a half, to expand our scope here and our reach and our community. So that's exciting, and will hopefully make the access a little easier for patients. And we are really ramping up our virtual visits because a lot of this, especially not necessarily in the pain side, but on the bowel and bladder function side, probably 75 or 80% of it is behavioral modification. So that can be done virtually, and of course, teaching the exercises and things like that can be done virtually. And then the other components, not necessarily need to have, or that they could actually come into the office for fewer visits and not necessarily have to come into the office for all of those visits. So it'll hopefully give a little more access to people that might not otherwise be able to physically get in and drive to where we were just with the one location previously.
Well, congratulations on the expansion and the satellite offices. I mean, would that, if you had, say, 50 new referrals come in tomorrow, would that new structure that you have and the additional office, would that be able to mop up a massive surge in demand, or would that cause a strain anywhere?
With 50, they would have to wait a few weeks, but we would be able to manage them. So that, but yes, that is the hope, that it will be able to expand that. What we really try to do is take a new patient in once we've sort of, make sure we have space to be able to get them in for follow-ups and things like that. So we'll try to stagger their starts, basically.
And for you, I guess you're doing a mixture of things. You're clinical, you're admin, you're in charge of marketing and staffing. What's the biggest time drain for you in the business at the moment?
The biggest time drain that doesn't feel productive is
Yeah.
probably the same for every healthcare clinician, which is charting. So, yeah, we've tried. I recently tried an AI, where it will chart for you and that sort of thing. It did not work well with the pelvic floor space, and I think AI eventually will remedy some of those things that are really challenging for us as clinicians. I don't think it's much different for any of the clinicians. Some of the clinicians are in a different scale than we are. For example, maybe a surgeon can have a scribe, and that's something that might be covered in therapy. That's not realistic for us, because we spend so long with a one patient. But AI is trying, so I think that it will eventually get there. But it just really, the models are built for more of a traditional physical therapy, and it really just didn't, I think, know what to do with the things that we're saying in a visit. But that was true also at one of our payers, that I had to meet with their panel, because they were pulling all of our charts and deeming all of them as that they should have been being billed as biofeedback. But I was like, wait, but we didn't do biofeedback. Why would we bill it as biofeedback? And when we did the review, it turned out that they're using similar technologies for everything. Anytime you said the word pelvic floor, it triggered it for being billed as biofeedback, but it didn't really have, it wasn't clearly delineated, and I guess in their format, that was a service code, or a procedure. And so we were able to get that remedied, but that was affecting a huge population for us, and triggering essentially an audit on every single patient that was under that payer, which was a lot of our volume. And so we were able to, they fixed it, and I don't think they've done a single one since. So just saying the word pelvic floor is it just throws all of that off. So hopefully that those kinds of things will get sorted out here soon, but one thing at a time, I guess.
Sure. I know you've got a podcast, which I think is just being launched, Pelvic Like It Is. Tell us a little bit about that, and where people can find it, and what you would hope they would get out of it.
So it is for the layperson, and it is typically what is, I feel like there are things that I say 50 times a week that are in there for the patients, that are part of the guidance and education that I give them, that are really simple to implement into your daily life. Like I mentioned earlier, the for men only, and that one is specifically for men who still have their prostate. And it will give you some real life guidance on things that you can you can do to make adjustments that will give you some relief with some of the bowel and bladder function or pain. And it's on Spotify and Apple. And I'm still learning with all of it, but I feel like I've got it at least to a place where it's digestible, and you can get to it. And they're pretty short clips, 30 minutes or less, and dive into a couple of different topics. And with being from my perspective, which is of being a single mom for a lot of years, with 3 children, and taking care of all these wonderful patients. And what I really hope comes out of it is that people's lives will be made easier, and they'll have access to some things that they'll probably be really surprised about that if they make a couple of little edits. We'll just be able to think about some other things besides their pelvic section during their day.
Thank you. We'll put that on the bio page so people can tune in and
Thank
have a
you.
listen. So you've had a very interesting career and journey. I just wondered if you were going to do it all again tomorrow, would you do anything differently?
I would, business-wise, I would probably have started doing pelvic health as the primary subject matter from the get-go. And I would have not taken insurance. As you know, here in the US, the physical therapists were the only practitioners that are not able to opt out of Medicare. So we would have had to have taken that still. But I probably would not have even done the insurance part of things and just been able to, just to very simply get paid for what we do. I used to joke all the time, if we sold coffee or chocolate, I'd be a billionaire. So just be able to give them the product and get paid for it would be quite simple. But I absolutely love taking care of patients for this, and I feel called to do it and compelled to do it. I'm not quite sure why, but it's really amazing to see someone's life changed with something that I think is a gift. And the reason I went into physical therapy to begin with, that it can be made without cutting on them or giving them any medication. Not that anyone, sometimes people do also need some of those things, but most of the time we're able to help them without those things. And I just think it's such an amazing thing that our bodies are so miraculously designed that they can be healed with what we're eating and what we're doing with our bodies.
And finally, what's on the cards for Smart Body PT in the next year? Do you have any plans for the next 12 months in terms of where you'd like to be, what you'd like to do?
Yes, I'd love to have more satellite offices. We're shifting our model to be able to hopefully enable other practitioners to be able to have. We've really, I've had the gift of having some amazing people help us with our marketing and branding, and so we have really just a robust referral referral sources, not just one. Thousands of clinicians and then online. But I would love to be able to have, I mean, eventually I'd love for this to be nationwide and for someone to have access to pelvic health, physical therapy, just as easily as they have it for outpatient physical therapy for their shoulder. So next door to every orthopedic clinic or inside of every orthopedic clinic, I'd love to have a satellite and then be able to enable other clinicians to support them in offering these services. That's one of the things that makes it really challenging to add pelvic health is training the clinician, because it is quite specialized. There's not a school for the specialty per se. It's postgraduate. So being able to train them and then support them, because it can be quite emotionally taxing. There are a lot of stories that we hear that gets me a little emotional to think about it. But there are a lot of hard things that you'll hear working in this space, and you really have to have support to be able to do that and to carry out that work. And so I feel like we do a really good job of that with our clinicians. That's the feedback that they give us, and we've tried to build that into their week to have that. And I think it's really important for being able to do this work for an extended period of time.
Laura, thank you. This has been such a powerful conversation, so educational. I think we're really learning about how pervasive pelvic health issues are and how much can be done using your kind of approach. So thank you so much for joining us today and sharing your knowledge, your journey, and what you're planning to do in the future. I'm very, very grateful.
Thank you. I really appreciate what you're doing and being able to get the word out for all of the functional medicine and all the health and wellness things that you guys are promoting. I think it's amazing, and I hope you keep it up.